Hello, everyone. If you have high cholesterol, you may feel stuck having to take medications or get tired of taking them, so you take breaks, or you may forget or be frustrated with the side effects from the medications. Or you may not even know if you have it. Well, stay tuned. This is for you. Today, we'll be discussing the importance of treating high cholesterol and give practical tips of what else you can do. Welcome to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye, and I'm excited you're here. This is the place to be if you desire to take charge of your health and do all you can to live a healthy lifestyle. Remember, you can always listen to this episode and all our other episodes on the In Touch Primary Care YouTube channel. And leave comments, subscribe, and please share with someone that might need it. You never know, it could make a huge difference for them. All right, so let's dive in. What is high cholesterol and why does it matter? Well, cholesterol is a substance that is found in the blood and everyone has some. It's actually needed for good health. The problem is some people have too much, and people with high cholesterol at a higher risk of heart attack and strokes and other health problems. And the higher the cholesterol, the higher the risk of these problems. So when you look at lab work, if you get your labs done regularly, you'll see that cholesterol is one of the ones that will be checked commonly. And you'll see that you have your total cholesterol, your LDL cholesterol, which is also known as the bad cholesterol. And that's because it raises your risk of a heart attack and stroke and other problems. And then you have the HDL cholesterol, which is also known as the good cholesterol, because when that one is high, people that have high HDL cholesterol tend to have a lower risk of heart attacks and strokes than other people that have a low HDL cholesterol. And then you might see the non-HDL cholesterol, which is basically the difference between your total and your HDL or good cholesterol. And then the last thing you may notice is called triglycerides. And triglycerides is actually not a cholesterol. It's another type of fat, but we measure it with the cholesterol most of the time because it seems that the high triglycerides will increase the risk of heart attack and strokes as well. So many of you may know that heart disease is actually the #1 cause of death in the United States, and coronary artery disease is the most common type of heart disease. And coronary artery disease is a major risk factor. High cholesterol is a major risk factor of coronary artery disease. And each year, more than 1 million Americans have heart attacks every year, and about 500,000 people die of heart disease every year. So it is a big deal. It's really, and that's not including disability and expense and all the other things that come with strokes as well, which can be caused by high cholesterol. So this is, unfortunately, people with high cholesterol will not have any symptoms most of the time. So that is where it gets really tricky. And that's why some people that are seemingly healthy, just seem to just die from heart disease all of a sudden. And many times their cholesterol might be a factor. So because it doesn't cause symptoms, it's really important that you check for it. So for example, I had a 30-year-old, about 30, he was in his 30s, a young man that came in for a visit. He was actually worried about his blood pressure because he had checked it somewhere and he thought it was high. But he hadn't seen a doctor in a long time. So I said, okay, let's do your labs and just make sure everything else is fine. And when we checked his total cholesterol, it was in the 300s. And a normal total cholesterol should be less than 200, 199 or less. And then his bad cholesterol, the LDL, was over 240. A normal LDL should be 99 or less, but ideally actually 70 or less. And we'll talk about that later. But this guy felt perfectly fine, but his bad cholesterol was 240. And I want to say this is an isolated incident that, it doesn't happen. But a few weeks before that, I saw another young man in his 40s who had his total cholesterol was 240 and his bad cholesterol was just over 200. So there are people walking around with high cholesterol and they have no idea. And both of them, if you ask them, will say, oh, we're healthy, we're overall healthy, everything is fine, we feel great. But they were pretty much at very high risk for a heart attack and stroke, and they didn't even know it. So as I mentioned, the higher the cholesterol level, the higher the risk. The lower the bad cholesterol level, though, the lower the risk. And if you look on your labs, most of the time they say your bad cholesterol should be 99 and under for most people. But many studies are showing that you need a cholesterol level actually lower than that to successfully reduce the risk, to significantly reduce the risk of heart disease. In fact, only 2% of people that have with heart attacks have a bad cholesterol less than 70. So a lot of people have a heart attacks actually have cholesterol in the supposed normal range. And so it's important that you actually look at those levels and make sure that you're trying to get your cholesterol as low as possible. So people with high cholesterol, what's happening in the body? Well, cholesterol in large amounts, what happens is they build up in the arteries. So if you think about your arteries like a pipe, and then you think about butter in your pipe, like cold butter that then gets hard, that's kind of like what's happening, where it's hardening, it's causing the arteries to get harder, and the blood cannot flow through because the arteries are narrower because of the plaque in them. And when blood doesn't flow through into a body part, the nutrients can't get there, and so that body part dies. And that's essentially what's happening when people have high cholesterol. So, like I said, very important to check. And typically, you can check, it's just a blood test. And it's usually done by your doctor when you see your doctor, every year, or, regular. As long as you see your doctor regularly, they can tell you how often to check. There are people that are at higher risk of high cholesterol, but everybody should be screened for high cholesterol. But people that have a family history especially need to really check their cholesterol levels. Other things like your diet, your activity levels can also affect your cholesterol level. And then we also have to consider other things, because at the end of the day, right, the cholesterol is not the point. It's your risk for developing serious health conditions. And so we need to take everything into consideration: your cholesterol level, your family history, your personal history of heart disease. If you smoke tobacco, that puts you at higher risk. And so looking at the big picture to determine how aggressive we need to be to lower your risk as much as possible. So somebody's cholesterol might be a little bit higher, but maybe they're overall healthy. They don't have diabetes, they don't smoke, they don't have heart disease, they don't have a family history. Their doctor may be more comfortable letting their cholesterol be a little bit higher than another person who has had a heart attack in the past or who is a smoker and all that. So we're taking the full picture into consideration to determine what a safe level for cholesterol is for each person. And so that's really important. So who should be checked? Well, actually, we even check children in some cases. So children that have certain risk factors can be checked for high cholesterol. But in adults, everybody over 20 should be checked for high cholesterol. And they may need to be checked sooner if they have a strong family history of it, for instance, or for children that are overweight may need to be checked sooner. So there are different recommendations, but for adults 20 and over, and how often depends on a lot of different factors. And if it's abnormal, of course, that would determine how often it's checked. So what can I do? So if you're thinking, okay, doc, I have high cholesterol, I've been told, what can I do? Well, first of all, don't take it for granted, okay? I mentioned men in the story, but there are women too with very high cholesterol. Don't take it for granted. Don't ignore it. It's important that you continue to check regularly and make sure that it's going in the right direction. So that's very important. It's very common, and so it needs to be checked. Don't ignore it. And if you are given medication for the high cholesterol, then take the medication. Don't get tired of taking it. Don't forget, if you have symptoms, side effects, talk it over with your doctor, but really make sure that the goal is to lower it as much as you possibly can. Now, what can you eat if you have high cholesterol? So your diet has a lot to do with your cholesterol. And if you've listened to other episodes that we've had here, you will find that a lot of the foods that help prevent serious health conditions are pretty much the same. So when you eat healthy, you don't only lower your cholesterol, you lower your risk of cancer, you lower your risk of high blood pressure, you lower your risk of diabetes. So a lot of the same foods help for many different things. So that's the great news. But for those that really want to be radical with their diet, the lowest rates of heart disease are seen in people that have removed meat, eggs, and dairy from their diet entirely. So people that are pretty much eating plant-based foods all the time. And people that do that, heart disease is virtually absent in those cultures that are able to do that. So if you want to be really radical about your diet, that's one option to really change, what you're eating. Remove meat, remove eggs, remove dairy, and that will really lower your cholesterol level. Okay, so that's one of the things, but not just removing and then adding, vegetables and making sure you're avoiding certain fats and all of that. But I know most people will have a difficult time doing that because food is cultural. It's very difficult for people to just suddenly change their diet. They need help and encouragement and support to be able to do that in a long term. So you can start somewhere though. You can start by adding foods that are high in fiber, and you want to get most of those foods from fruits, vegetables, whole grains, and legumes. So you can add foods that are high in fiber from fruits and vegetables, and also from whole grains and legumes. So that's one thing you can do for high cholesterol. The other thing you can add, so if you remember, I talked about the good cholesterol, you can add fats that are the good fats, okay? So you may have heard that fats are bad, but there are actually certain good fats. And for example, things to look out for. If you're comparing two things and you're trying to figure out which one is healthy, if it has saturated fat, that is unhealthy fat. So you want to pick the one with the lowest saturated fat content. Trans fat, you want to avoid completely as much as possible. So if you're comparing the labels of two products and one has trans fat and one doesn't, pick the one without trans fat, okay? Now, there are other types of fat. There's polyunsaturated fat and monounsaturated fat. And those two types of fats are typically found in nuts and seeds primarily. So like flaxseed, chia seeds, walnuts, almonds, those types of things. So you can find good fats in those. And so you do want to increase your good fats to raise your good cholesterol, because that actually helps lower your risk of heart disease. So you can eat lots of fiber from fruits and vegetables, from legumes and whole grains, and then nuts and seeds. And then supplements have been helpful for high cholesterol, especially dietary supplements with plant stanols and sterols. And those, the most common one is red yeast rice. And that acts similarly to statins in reducing your bad cholesterol, especially when you do that in combination with a low saturated fat diet that can help reduce your cholesterol. So those are some of the dietary changes that can be made to help lower cholesterol. If you're making dietary changes, and you're taking medication, you absolutely need to do this with a doctor. Don't stop your medication. You have to check to make sure it's working, and before you start making changes to your medication. Don't try to do it alone, because you can put yourself at very serious risk. The other thing that you can do is start to exercise. So increase activity. And you know me, I prefer baby steps. So just start with about 10 minutes daily. And your goal is to increase that time over time. And then both the patients I talked about earlier now have their bad cholesterol under 100, but I'm still pushing to get it lower because, like I said, the lower, the better. So, you know, even though you may have normal cholesterol based on what it says on the value on the lab sheet, but whatever you can do to push it lower, do it. It's worth it for sure. You want to get it as low as possible. And you can do this by incorporating fiber, remember, from fruits and vegetables. Just do the best you can, add as much as you can. And then also legumes and whole grains, nuts and seeds. And then start exercising, increase your activity as much as you can. Of course, there are other things that you can do. If you do smoke cigarettes, you want to quit smoking, you probably need help with that. You can go to your doctor for that. You want to try to reduce your stress levels as well. So there are other things that will contribute, but the most significant things you can do are lower your, modify your diet and increase your exercise. And if you smoke, definitely quit smoking will be very significant. So if you have not checked your cholesterol, or you need your doctor to help manage your medications, like you have high cholesterol and you need a doctor to help manage, and you're in the Houston area, come and check us out at In Touch Primary Care. We're proactive about your health, and that's why we do things differently here. Our practice is set up so that we can spend time with our patients so that they can reach us easily and they don't have to delay their care. And we can see you even if you don't have health insurance. So you can find out more information on our website, www.intouchprimarycare.com. So if you have high cholesterol, it is possible to do certain things to lower it. And even if it's not high, you can get it lower by doing certain things. So imagine if you start, eating healthier, you will feel a lot better. Your mood will be better. You'll have more energy. You'll have more mental clarity. You will definitely save time and money and definitely prevent serious health conditions. So, and apart from all that, it wouldn't just be the cholesterol that you're lowering. You will lower your risk for many other health conditions. So it's certainly worth it. Well, that's all I have for today. So if you found this helpful, go ahead and share with others. There might just be someone that really needs to hear this. So please go ahead and share with as many people as you think it might be helpful to. Thank you. Until next week. See you later. Bye.